Hi everybody, another one of our introductions at the surgery, and today I'm with Sarah. Hi Sarah.
Hello.
How are you today?
Very good, thank you.
Very good. I wonder if you tell us a bit about your role, your job here at Lion Health, please.
Okay, so I am one of a team of the practice-based pharmacists, so we are known as the in-house pharmacists here at Lion Health. I have been here at Lion Health for about 2 years now. My background prior to that, I worked in community, so I was a community pharmacist dispensing medication. But we have the team across the board. We have a varied background, so some are hospital pharmacists, so we've been in primary care for a really long time, so they're very experienced. And then there's also other community pharmacists as well.
How many pharmacists are there roughly? I'm not going to test you too much, but how many pharmacists are there working at Lion Health?
So at the minute, there's about 6 of us.
Wow.
Who sort of dip in and out as the week goes on.
Okay.
So yeah, no, that's really good to work as part of the team.
And tell me, like this morning, for example, what sort of things have you done? I mean, it's only 10 o'clock, 10:30, but already you've had a bit of a varied morning, or what sort of things do you do?
Absolutely no. So our days are never the same, and it's really varied work. So we work quite hard to deal with medication queries, whether that be from patients or from clinicians within the practice. One big thing we're dealing with at the minute is sort of stock issues, out of stocks, finding alternatives. And to do that as well, we work quite closely with the local community pharmacy, see what's available and sort of what the situation is there, whilst making sure it's appropriate. I have also been working hard to reconcile all of the letters that come into the practice.
Okay, reconcile letters, tell me.
So medicines reconciliation is a really big part of our work. So if a patient is admitted to hospital and has changes whilst they're there, or if they go and see sort of a specialist clinic and they have medication changes, we work to sort of update their repeat list here at the practice, and the patients are aware and happy of sort of how to order that medication moving forwards.
Wow. How do you keep up to date with all this? I mean, what, in terms of your training, obviously you went to university and you've done a degree in pharmacy. How do you keep up to date? Because it's constantly drugs are coming in and new drugs are often being talked about in the media. How do you keep on top of all that?
Moving into primary care, we have to do additional training. So that will either be in the form of a clinical diploma or an NHS pathway training. Some of our pharmacists, I should have said, are prescribers,
right.
So they will be able to prescribe within their scope. So they've done additional training to do that. Some of us are currently undertaking that training as well. So that will only continue to expand. With regard to new medication things coming out, we have sort of bi-monthly pharmacist updates, meetings, whereby new guidelines are shared to make sure we all stay up to date. And then that's obviously cascaded through the practices as well, so keeping us all.
And Sarah, so many people are on medication. You'll probably tell me the stats for the average number of medications that people receive. But in terms of reviewing medication, are you involved in that? As I know I am as a GP, but do you do that too?
Yeah, so we run clinics where we offer medication reviews to patients who are on long-term medications. Usually following their annual review here at the practice, we will try and check in with the patients just to sort of see how they're getting on with their medication, if they've got any issues or concerns. Sometimes it's a case of they may need additional medication. Sometimes it's a case of we can try and reduce those numbers down, because like you said, many patients are on multiple medications, so it's finding that balance and deciding what's best for that patient along with their opinions.
My last question, you're pleased to know, COVID. I seem to remember seeing a lot of you during that pandemic COVID influenza vaccine. What was your role then when you did that?
So we're still quite heavily involved. We were heavily involved and we are still involved in the COVID vaccine programmes. Our role within that was to ensure the procurement of the vaccine, to make sure we could get the supplies, to make sure that all of the necessary sort of safety aspect was covered, so all the paperwork and things, and it was maintained and stored in the correct way. We were also involved in sort of preparing all of the vaccines for the clinicians. So we drew up every single syringe that would have been administered.
Wow.
So yeah, we've done a lot, and we're still involved with sort of the care home programme and the housebound programme.
So a really varied role in primary care, but definitely an essential one in primary care.
Thank you.
So really useful to speak to Sarah this morning about her role as a pharmacist at Lion Health. So thank you very much, Sarah.
No, thank you.